Boy, I just finished that water fasting. Boy, did it do a number on me. I'm just kidding, guys. Hey, I just wanted to get on and chat a little bit about my 72-hour fast that I did earlier in the week. Had some good questions posted and some people doing some great things by the sounds of it. So I first just wanted to do the little disclaimer. I'm not intending to be a fasting consultant for anybody on here. We our patients, and when we can help guide them and make sure that they're doing things properly, we definitely help them through that and encourage them to do different things. There are some preliminary things that I recommend people do before they jump into that, and we're going to kind of go through that in our little PowerPoint here. So let me get that added here. All right, so like I said, we ate dinner on Sunday evening, and then I had dinner late on Wednesday evening. And I would say to begin with that breaking your fast is almost as important as the fast itself, as far as when you're coming out of it, doing it the right way. And we're not going to cover a ton of that today, other than just to say that it's not a wise decision to fast for 3 days and then decide to go eat a giant steak and French fries or something like that. You definitely want to, your digestion hasn't been working for a few days, which is going to have all the health benefits we're going to talk about, but also you need to kind of ease it back a little bit to get things primed and ready before we're starting to get back to a normal diet. And definitely the longer you go on a fast, the more critical that reintroduction phase is. So a 3-day one, not that it's not important, but when you're doing a 5-day one, very important that you break it, and you're going to do maybe some brothy soups and some different things as you're just kind of, again, trying to stimulate some digestion and secreting your different digestive juices, stuff like that. So, but let's talk about some health benefits and some contraindications. So to be honest with you, fasting, a lot of people do the intermittent fasting, which is popular with a lot of people today, where they'll just eat in certain windows. They'll do an 8-hour eating window, or some people will push to a 6-hour eating window or something like that. And so for a lot of people, that's an effective way of just kind of controlling your blood sugar swings. And it really does help increase over time some insulin sensitivity things, which is a good thing. We know that type 2 diabetes is really just a lack of insulin sensitivity. And so a lot of the things that can happen from just doing intermittent fasting, a lot of people experience some weight loss, better steady energy, stuff like that. And so those things are fine to do. I always tell people, if they're new to this, jumping into a 20-hour fast with a 4-hour eating window is probably not the way to do it. If you're normally, used to eating your 3 squares a day, and you're usually not fasting for more than like 8 or 9 hours, then, starting on a 12-12 may be a good place to start for you. And if the body tolerates that well, then, you can go to a 14-10 or something like that, and then kind of slowly increase that window. I get a lot of questions about, is it better to not eat breakfast? Is it better to not eat dinner, or whatever? And the truth is, it doesn't matter completely on that. Some people, they really love breakfast or they like to have a big lunch. And so you can kind of keep your window anywhere you want on the intermittent fasting side. So now getting into the understanding benefits from our water fasting only. So water fasting only involves consuming only water for a set period. So today we're just kind of talking about a 1 to 5 day period. There's many people that have done a lot longer than that. I just always recommend anybody who is going to do any type of extended fasting that if they're not experienced and know really what they're doing with it, that they really should be following and doing it under the direction of their doctor. So we don't want anybody to have too much of bad swings or have something negative happen. So we're having no food or no caloric intake, just purely hydration. People asked a lot about salt, because we do recommend that you're putting some either some Celtic sea salt or the Baja Gold or the pink Himalayan, something like that. So that way you are getting minerals into your body, because those are essential, and we need to make sure so that we're not getting cramping, or that all of our processes continue to work in our body. A lot of people use this for a detoxification process when they start getting into the longer fast, a metabolic reset. So what we do know is that when we go, for a 3-day or 5-day or 2-day or 1-day, whatever fasting, and we cut calories for that period of time, that changes your metabolic function. So the body, the longer you do anything, the more the body accommodates to it. And so it's important, if we start with a 1-day fast, probably not going to be overly challenging to the body. But as we get longer in those fasts, we really have to pay more attention. And the metabolic, when you're on those longer fasts, I will tell you that refeeding period is actually, again, super important. A lot of research is supporting that a lot of the benefits from fasting that occur are magnified or improved even more when you go through your refeeding period, and you're kind of doing a few days of eating more food, almost like a feast, fasting feast cycling. So that's an important thing. There's a lot of health benefits to it, and we're going to cover those in a second. But again, should be done with caution and proper understanding of what you're trying to accomplish. So one of the things that I always tell people is that if your body is not well, and your energy, if you get into a 24-hour fast, or let's say you plan that you're going to do a 3-day, but you get 24 hours in and your energy is just crashing, and you're not, you're miserable, all of those things. It's not just one of those things that it's like, hey, just push through. That's not a good plan. I had a person that we were going through some fasting stuff, was a really self-determined person. And we were doing a 5-day fast. On day 3, just was really struggling. Energy was really low. Blood sugar was dipping. Ketones weren't going up high enough. And so wanted to try to persevere. And I basically, came to the conclusion that that's not a smart thing to do. So we just needed to eat, and we needed to get some food back in so that he could start recovering from that. And usually if that happens, it just tells us that, there's metabolically, there's something challenged in the body. So maybe there's some underlying toxicity. Maybe we've got too much cellular inflammation. There's a lot of different things that can trigger the body. Most people in our society, unfortunately, are sugar burners, meaning that we consume enough carbohydrates on a regular basis that the body really isn't primed and ready to go into a ketosis state. And so when you're usually, by the time you're getting into that day 2 period, you've exhausted, all of your sugar reserves, all of that stuff. And if your body is struggling to kind of get into a ketotic state, then that's when a lot of those symptoms really start to arise. And you just need to listen to your body and know when it's time to stop and feed yourself again. And then again, work on some things, and then you can try it again down the road. So there's a lot of benefits to fasting. So one of the big ones that's talked a lot about is cellular autophagy. That supports the body's ability to remove damaged cells and start a regeneration process. So cells have a programmed lifespan to them, and sometimes they're hanging on a little bit longer than they should. And when you're not feeding yourself, then the body says, hey, I can get some resources out of these cells. Let's clean all this stuff up, so that way we can recycle the cellular components that are recyclable, and we can utilize that to maintain ourselves in existence. So you get a lot of fat loss if your body gets into ketosis, because that's what it's burning for its energy at that point. And you actually get a good metabolic boost because it helps your body choose fat as a fuel easier. So you're kind of reconditioning some of those sugar burner situations. There's a lot of evidence about it reducing inflammation, and especially people that have chronic inflammatory issues. And we know through most of the videos that I do that we talk about, chronic inflammation is linked and rooted to pretty much all of the chronic diseases. So that's an important thing that we want to get under control. Another big thing that people report a lot is mental clarity and focus. So you'd think that, if I haven't eaten for a while, that all of a sudden I'm going to be just the opposite. All I'm going to think about is food and all this stuff. And, and if your ghrelin levels if your ghrelin's talking at you, it can be a little distracting. But for the most part, most people will talk about how much clearer things are. And that has a lot to, again, due to the fact that your brain is burning those ketones, and you just get an increase in mental clarity. One of the things as we get further along in the fasting process is some stem cell regeneration in the intestines, the immune system, and the muscular system. I don't have I didn't write myself up as a study, but what got me interested in fasting years ago was I had a small tear in a tendon down by my Achilles, and I got an MRI done on it, and talked to a surgeon. Told me the surgery's like this, 6-minute surgery, super quick, but the rehab was this really intense 3-month-long thing. And then that's when stem cells were first starting to come around. And he said, you could always try to do like a stem cell injection in that area. Well, I just happened to be going to a fasting research seminar. And so I went to that, learned about the benefits of regenerating in the muscular and skeletal system as well. And so I did some extended fasts for a period of time. And all I can tell you is I can do the things that I couldn't do before after the fasting. So I give credit to the fact of, not eating for a few days, a few months in a row. I think saved myself a good chunk of money on going to get stem cell injections, because I think my body was able to supercharge itself and repair itself. And so our next slide is really talking about people that shouldn't be fasting. So obviously pregnant or nursing women, we cannot be fasting because they have higher nutritional needs. People with eating disorders, because that can really start to trigger some of those unhealthy behaviors back in. People on diabetic medications, they have a risk of hypoglycemia. There are research things, and there are things out there where people have been able to do that, but you definitely, there's no one should be doing that without being under a doctor's supervision if we're having blood sugar problems like that. Those with severe low blood pressure, fasting can a lot of times reduce blood pressure further, so we have to be careful. And then also you have to make sure if there's medications out there that can alter the effects of medicine if we're not consuming food. People with any type of chronic disorders, like I said, should be under medical supervision. Consult with your healthcare provider before you try to do any fasting. Now, I did have a question too. Sometimes people, they are either at weight or maybe on the low end already. They've got some health challenges, and so they would like to get some health benefits out of fasting, but yet they really can't afford to lose weight, or they don't want to have that effect. So the first thing is there is something out there called the fasting mimicking diet, which does allow you to still consume some calories, but it's done in a way that allows your blood sugar and your insulin stuff not to spike. So you get a lot of the benefits of fasting. If you look up the fasting mimicking diet, I'm actually not sure if they're still doing it, but they actually used to have a group of prepackaged meals that you could get that you could consume to make sure that you were keeping yourself in line. But I would also tell you that in those cases with somebody that's like that refeeding period is just absolutely crucial. It's like as soon as that digestion gets going and it gets turned back on, I think, like I said earlier, the refeeding period and having some feast days where I'm eating a higher calorie content than maybe I normally would, even some higher healthy carbohydrates than I normally would, just to kind of give your body the reassurance that we're not in a starvation situation. Because that's one of the challenges. If you're doing that stuff too frequently, then the body starts to wonder when the next meal's coming, and that can start to have a negative effect on metabolism. So we don't want to do that. We want to just keep people thriving and going strong. So just some quick summary here. Try to keep this one under 15 minutes for you guys. But so it has a lot of potential health benefits. I always recommend people start with shorter periods or even the intermittent fasting before they jump into it. Always stay well hydrated. And again, break your fast properly, depending on how many days you're going. There's keys that you need to know to break that. If you're not sure about any of this stuff, reach out to your doctor, talk to them so that you can get some proper advice there. If you want to learn more, consult with a health expert. Like I said, primary care doctors. There's a lot of people out there that have a lot of knowledge in this, and they can help you through that journey. So that's what I got for you guys today. My 3 day it went well. I've done quite a few of these, and I think the mental part of it is easy for me at this point. So it's not, I didn't, the first couple that I did, I remember going through some tough spots, but it hasn't been that way the last few times that I've done them. And I think it's just because, I'm conditioned mentally to it. Because most people that break, their fast, it's more of a mental block for them that usually hits them on day 2 than it is physical. But again, we got to listen to our bodies. So there's no judgment there for people. People ask about working out during fasting and all that stuff. The very first one that I did not work out until the Friday because I had read that it's a good idea to do some exercise before you start your refeed to kind of wake your metabolism back up. But since then, I've worked out during my fasts as well. Knowing that, I'm breaking down some muscle, I'm not bringing stuff in to rebuild as much, but, metabolically, I feel like I still do well and thrive in those situations. So you got to just listen to your body. I do it during the week always, because for me, if I'm busy, if I'm at work, I'm doing things, I just don't think about food. And so it's easier to get through that. So everything went well for me through it, and got some good health benefits out of it. And so I'll keep you guys up to date. One of the things I didn't talk about, which is human growth hormone surges that occur when you're doing that. So that's your kind of recovery and helping to rebuild. Your body starts to try to protect itself from breaking down muscle once you get into those longer fasts. And that human growth hormone raises to help protect muscle mass and help the body force it into fat burning. So again, another little side benefit there that I feel like is worth mentioning. So you guys have a great rest of the weekend, and we'll get a question up next week, and we'll see who wants to learn some more. Guys, have a great day.